Your body gives you a free health report every single day, and most people flush it without looking. I am not being funny. As a nephrology nurse for almost 30 years, urine is one of the things we assess because it can give us clues about what's happening in the body. Today, I am going to walk you through every color from pale yellow to brown to red, what each one actually means, which ones are harmless, and the two colors that should send you to the doctor this week. By the end of this video, you will know more about reading urine than most people ever learn. If this is helpful, give me a quick like so I know to keep making videos like this. Let's start with the color that everyone asks me about. But before we get into individual colors, you need to know what's actually causing the color in the first place. Urine gets its color mostly from a pigment called urochrome. Your body makes it as a byproduct of breaking down old red blood cells, and your kidneys filter it out into your urine. The more water in your system, the more that pigment gets diluted and the lighter your urine looks. The less water, the more concentrated it gets and the darker it looks. So a huge amount of what you're seeing in the toilet bowl is really just a hydration story, but not all of it. Foods, medications, vitamins, and certain health conditions can shift the color too. And that's where it gets interesting. Let's start with pale yellow to straw yellow, because this is what normal urine color actually looks like. If your urine is somewhere between pale yellow and a light straw color, that's generally a normal urine color and usually means you're well hydrated. This is the color you're aiming for. It's not glamorous, it's not exciting, but it means everything is working. Now, clear or almost colorless urine feels like a win to a lot of people because we've all been taught that clear equals hydrated. But if your urine is constantly clear, you may be drinking more water than your body needs. Occasionally, clear urine isn't a problem. But if it's constantly clear, especially if you're not drinking large amounts of water, that's worth mentioning to your healthcare provider. And if you're finding this helpful so far, drop a comment below with the color you're most curious about. I read every comment and I might make a follow-up video on the ones people ask about the most. Now let's talk about dark yellow to amber urine, because this is the one I get asked about constantly. Most often, dark yellow or amber urine is a sign that you need more fluids. The pigment is concentrated because there isn't enough water to dilute it. The fix here is simple. Drink water and watch the color lighten back up over the next few hours. And this is assuming you do not have severe kidney failure. If it doesn't lighten up, no matter how much you drink, that's worth mentioning to your doctor because it could point to something beyond simple dehydration. Next is neon or bright yellow urine. And this one surprises people because it looks almost alarming, but it's usually completely harmless. This is most commonly caused by vitamin B2, and it shows up in a lot of multivitamins and B complex supplements. Your body only absorbs so much of it, and the extra gets filtered out by your kidneys and shows up as this bright, almost fluorescent yellow. If you started a new multivitamin recently and your urine suddenly looks like a highlighter, that's very likely your answer. Now, by the way, if you're looking at your kidney lab results and you're not quite sure what those numbers mean, I created a free kidney lab companion guide that walks you through some of the most common kidney labs in plain English. I'll leave the link for you down in the description. Orange urine is next, and this one has a few different explanations depending on what else is going on. The most common cause is simple dehydration, same as amber urine, just further along that spectrum. Certain medications can also turn urine orange, including some used for urinary tract infection. But there's one cause I want you to pay attention to. If your orange urine is showing up alongside pale or clay-colored stool or yellowing of your skin or eyes, that combination can point to a liver or bile duct issue. And that's not something to wait out. That combination is worth a call to your doctor. Now let's get into two colors that actually warrant a doctor's visit this week, starting with brown or cola colored urine. This one gets confused with just being really dark, But true brown or tea color urine is different from amber. It can be caused by severe dehydration, but it can also point to liver problems, certain muscle injuries, or in some cases, kidney involvement. If your urine looks like brown tea or cola and it isn't clearing up with water and rest, that's a color I want you to go get checked out. Not Google diagnosed. I am not going to sit here and tell you exactly what's causing it from a video because I can't. And honestly, no nurse or doctor could without actually seeing your labs. And the second color that needs medical attention is red or pink urine. Now, before you panic, red or pink urine can come from something as simple as eating beets, blackberries, or rhubarb. That's real, and it happens more than people expect. But red or pink urine can also mean there's blood in your urine, and that can come from a urinary tract infection, kidney stones, or in some cases, something more serious that needs to be ruled out. Here's my rule of thumb. If you know you just ate something like beets that can change the color, that may explain it. But if there's no obvious explanation or you think you may actually be seeing blood, get it checked rather than trying to diagnose it by color. This is generally one of those symptoms where I would rather you get seen and it turns out to be nothing than skip it and it turns out to matter. Green or blue urine is rare, and honestly, most people go their whole life without ever seeing it. When it does happen, it's almost always tied to certain medications, some medical dyes used during procedures, or in rare cases, a urinary tract infection with a specific type of bacteria. It looks alarming because it's so unusual, but on its own, it's rarely an emergency. If it shows up out of nowhere with no medication or procedure explanation, mention it to your doctor just to be safe, but don't panic over the color itself. And last, cloudy, milk, or white urine. This one is usually tied to a urinary tract infection, especially if it comes with a burning sensation or urgency. It can also happen from high amounts of proteins or crystals in the urine, or in some cases from dehydration concentrating mucus and cells that are normally too diluted to notice. Cloudy urine on its own isn't usually an emergency, but paired with pain, fever, or burning, that combination is worth getting checked. If this video is helping you make sense of something you've been wondering about, do me a favor and share it with someone who overthinks every bathroom trip, like I know some of you do. It generally helps more people find a channel like this one. So to recap, the two colors I really want you to remember: brown or cola color urine and red or pink urine that isn't explained by food. Those are the two I want sending you to a doctor this week, not next month. The other colors we covered are often explained by hydration, food, medication, or vitamins. But if a color change is persistent, unexplained, or comes with other symptoms, get it checked. I want to be really clear about something before we wrap up. Urine color alone should never be the one thing you use to diagnose yourself. It's a clue, not a diagnosis. Pair what you're seeing with how you're feeling. And when in doubt, get it checked instead of guessing. And if you want to know what else your body might be telling you that's easy to brush off, I made a video on 12 kidney disease symptoms most people ignore. And you can check that out by clicking right here. I'll see you there.